Hello, my name is Sophia and this is my portfolio submission for Assessment Task 1 in Perioperative Nursing. Throughout this presentation, I will discuss how nurses can provide high quality and safe patient-centred care during the perioperative phase. Specifically, I will be discussing handover between a ward and preoperative nurse and how this can be undertaken most effectively to ensure safe and quality care for the patient. Prior to beginning preparation for the perioperative phase, the nurse needs to ensure ethical principles are being upheld and informed consent has been given by the correct patient. Koifman et al. 2015 suggests that this involves confirming the patient's date of birth, full name and UR number, and that the patient is fully informed about the upcoming procedure with risks discussed and their understanding of this assessed. The patient must also be competent to consent and must consent voluntarily. For example, non-English speaking patients should receive a translator, or a person under the age of 18 should have a parent or legal guardian give consent for them. After consent has been confirmed, the ward nurse needs to arrange and organise the process that will be undertaken to hand over to the pre-op nurse. This preparation should involve planning the setting that is appropriate and that maintains patient comfort and safety. To do this, the ward nurse could consider a bedside handover. As discussed by Luperai, Creati and Police 2016, bedside handover alleviates patient anxiety for the upcoming procedure, as they are able to observe the information about their procedure being conveyed to another healthcare professional, giving them more confidence in the medical team to handle their procedure with care and competency. It also provides the opportunity for the patient to be involved in care decisions. Bedside handover also improves the safety of patient care, as the patient is involved and can correct any incorrect information. Handover should also be conducted using the same system, such as ISOBAR, organisation-wide, to reduce the risk of handovers being inconsistent and ineffective. ISOBAR is a handover checklist that is an acronym for Identify, so you're identifying yourself, the patient and the location. Situation, reason for the procedure, current patient condition, and has the patient given consent. Observations, does the patient seem anxious, what's their mental state? Background, past medical, surgical, medical history. Do they have any allergies? Are there any CT scans? Assessment, so you've got their baseline vital signs. How is the patient feeling at this moment? And requests, so requesting any impending procedures, any nursing requirements, such as should any medications still need to be given. And according to Redley et al. 2016, factors that impact on miscommunication during handover include inconsistent handover processes, and using the ISOBAR handover improves the safety of patients and reduces negative outcomes. To further ensure quality of care throughout the whole perioperative process, National Quality and Healthcare Standards 2012 suggests that relevant healthcare workers could be present during the initial handover in order to maintain effective communication. This will prevent inconsistent handover processes and duplication of processes, as well as allowing the relevant healthcare workers to confirm a plan of care they will all agree to. Using the above techniques will ensure effective communication between the multidisciplinary team and the handover between ward and pre-op nurse, resulting in the successful transfer of liability of care, therefore providing the patient with high-quality, patient-centred care throughout their perioperative journey. I hope you enjoyed my presentation. Thank you.